Today's class we will see about the natural history of disease. What is natural history of disease? Natural history of disease means how the disease is progress in our body. Any microorganism attacked. Why we have to study? Why we have to know about the natural history of disease? In this world there are many new now you take it currently the coronavirus, new variant of coronavirus emerging. So we have to study or we have to learn about how these to understand what is the clinical pathology, how it is the what is the different signs and symptom, how it is important to the patient care, where this it is affecting, and what is the preventive measures. Any drug trials can be find out to prevent those viruses and to identify what are all the risk factors, and then to identify the calculate the prevalence of disease. If this virus is spreading very fast, what will be the prevalence will be so high. That is the main purpose of studying the natural history of disease. End of the class I will tell you one Nuremberg, what is the natural history of disease, what they have done with the syphilis, how they got punished, and then how the Nuremberg code is evolved. You listen before that. So this is the main purpose of doing the natural studying about the natural history of disease. You see, this is the diagram you can see everywhere about the Park book. So any of the disease you can divide into the period of pre-pathogenesis and the period of pathogenesis. In the pre-pathogenesis period, the disease can be preventable stage. The level of prevention, it can either the wearing a mask or going avoiding to the anywhere you can prevent it. In a pre-pathogenic disease, you have to understand, according to epidemiological theory, they are telling any disease, it's a mandatory to know there is a agent-host environmental interaction. Right or not? So this bring the agent and host to be together. It provokes stimulus. Some stimulus will be provoking anywhere, agent-host environment interaction will be before the new host involved. There is a agent and environmental influence. What will happen? This is a pre-pathogenic. Any disease in epidemiological theory, it says that there is an interaction between agent, host and environment. So with that is the human host. What's happening in the human host? Once the human host it's entering, what's happening? Early pathogenesis started. In this early pathogenesis started, and then once this early lesions, maybe some lesions or some signs and symptoms will be appear. Sometimes advanced disease may be progress up to the convulsions or any extreme end of the disease it may go. And also there is an interaction stimulus. The human host interaction stimulus, host also will be reacting. Are you understanding? The reaction either will be recovery. What will happen? What is happening in this human host? Also there is a tissue and pathological changes. And also in the human host there is a multiplications of the number of microorganisms very fastly. According to these multiplication of the stages, there is the advanced stages from the early lesions to the advanced stage, either convulsions or the death. So what's happening in the clinical origin? So this is all the pre-pathogenic period. It is inside the body, it is happening. What is the signs and symptom which is visualized outside? You can have the illnesses. What kind of illnesses? May be disability, difficulty in breathing, or increased fever, or defect, or the chronic state of cannot able to walk. Right or not? My father was telling, no, I couldn't walk. Even 2 steps make me disastrous palpitation, and I am very much tired and I cannot breathe, he is telling. So immediately the corona was negative, but it was affecting internally. There is a pathogenic stage. Fully 80% of lungs collapse. This was the signs and symptoms. In these things, either this illness will go for further advance, will be going for the death, or it will be coming for the recovery. Are you understanding? Either it will be go for the death or it will be come for the recovery once the person will be coming. So this is the stage. Any illness, any of the disease, not only corona, you can take dengue. What will happen? Dengue, signs and symptoms of dengue. Symptoms, many things. It will be affecting pathogenic changes in an advanced way. Internal bleeding will be going on, but you cannot see only external bleeding. You can see once the melena is coming, you can see the internal bleeding. Further, the person will be improve or will be recovery. These things will be happening. In this, one natural history of disease. In the purpose itself we will see, it will be helpful to the primary prevention, secondary prevention and tertiary prevention. And then what is primary prevention? Early identification of vaccination and giving them specific protections. Are you understanding? And then health promotion, that's the thing, the purpose we are studying the natural history of diseases. Secondary, early identification, early isolation, early admission and early diagnosis and early treatment. And then tertiary will be early rehabilitation. What is rehabilitation? Rehabilitation is a medical, social, psychological measures measures and train and retrain the individual to lead the maximum normal life, potential life. So that is called the that is the thing we are telling about the rehabilitation. So the rehabilitation has to be started when there is an initial stage itself. You have to, that is the current trend in rehabilitation. You no need to wait for the tertiary stage for the prevention to the rehabilitation. You can wait once the person is disease is started, process is started in a pre-pathogenic stage itself. The level of prevention, primary prevention itself, you can develop the rehabilitation. You can tell the consequences, what will happen, like that you can tell to the individual. So this is about the natural history of disease. If a 5 mark they have asked, you have to draw this diagram and you have to write. This is the clinical origin. You can see this is the internal body, what's happening. This is the before pre-pathogenic stage, before the host is being affected. Okay. Then there is an interesting one I told you. In the natural history of disease, during the during the World War II, what had happened? There is a Nuremberg Code of Ethics has been evolved. How this evolved? I told you the purpose we have seen to understand, to progress the disease for the clinical trials. Usually these drugs trials and all, usually they will do it with the rat and animals or mouse, something they will do it. But what happened during the trial in the World War in 1945 to 46, what's happening? There is a horrible human experimentation done by the whom? Nazi doctors. Nazi doctor during the World War II. To whom they have done? To the criminals. What did they have done? Why they have done? They want to study the neurosyphilis. That time they have found out the penicillin is the treatment for the bacterial infections, but they did not give penicillin to the patient. They let the patients to develop the syphilis. You know, syphilis is a caused by the trypanosome of pallidum. So what the human experiment they done with these prisoners? Most of the prisoners were severely suffering and they died also. Then they understood what is the natural history of disease. Like in this syphilis, how it is interacted with a human being, what it happened, what is the reaction, and in the neural symptoms, what they have done, either they have developed the convulsions or anything, they were checking. It is like very, very unethical behavior, doing the harassing the criminals. So what happened? This act of these Nazi doctors, the atrocities committed by these doctors leads to the development of ethical guidelines. So it is the one bad thing happened, from that some ethics has been formulated and framed. They have developed there is a one person, he is called the Nuremberg Codex in the US court. Afterwards Bill Gates, not Bill Gates, Clinton, I think, US presidents had done the compensation to the prisoner's family. But whatever it may be, that's mainly they protect the human subject in the research. You are not supposed to do these kind of the natural history of disease or any drug trials to the human being. That is injecting the whatever it may be, making the to develop one syphilis and seeing how they are dying. It's inhuman and it is an unethical behavior. Understand? So this is about this is the incident had happened. I would like to say, because they want to study about the natural history of neural syphilis, they have done this unethical Nuremberg trial. That's just I want to tell the interesting story about how the ethical principles has been evolved. You are studying ethical principles in the professional ethics chapter. So I hope you have understand clearly about what is the natural history of disease. So it is divided by the two areas. First, pre-pathogenic and the period of pathogenic. Pathogenic again will be clinical symptoms and will be bodily factors. And overall that it is divided by the primary levels of prevention, like primary, secondary and the tertiary prevention. Thank you.